All right, today we're diving into something that flies under the radar for a lot of people, but it's super common and can have a huge impact on your health. We're talking about magnesium deficiency.
I mean, be honest, how often do you really think about magnesium? Probably not much, right? But what if I told you that not having enough of this one mineral could actually cause some of your body's most important systems to just fail? It's a kind of silent emergency, and it might be way more widespread than any of us think.
And look, this isn't just some theory. Check out this number. Some studies have found that up to 65% of patients in the ICU, the most critically ill people in the hospital, have low magnesium. 65%. That's a staggering figure, and it immediately connects this deficiency to some really severe, life-threatening situations.
Okay, so what is magnesium really, and why is it so incredibly important? Let's break it down. The best way to think about it is like a multi-tool for your body. Seriously, it's an electrolyte, so it helps with all the electrical stuff in our cells, but it's also a cofactor, basically a helper molecule, in over 300 essential reactions. We're talking about everything from copying your DNA and building proteins to making sure your nerves fire right and, crucially, that your heart keeps a steady rhythm. Magnesium is smack in the middle of all of it.
But here's the kicker, the thing that makes this whole issue so sneaky. Take a look at where our bodies actually store this stuff. The huge majority, like 60%, is locked up in our bones. Then another 39% is inside our muscles and other tissues. You do the math, that leaves less than 2% floating around in our blood. And that right there is a critical piece of the puzzle, because it makes this deficiency unbelievably hard to find.
So if it's so important, how on earth do we end up running low? Well, it turns out there are a few main reasons. It really comes down to three basic problems. First, intake. We're just not eating enough of it. A lot of modern diets are full of refined foods, stuff like white bread, where all the good magnesium-rich parts have been stripped out. Second, absorption. Even if you eat it, your body might not be absorbing it right, maybe because of gut problems. And third, loss. We could just be getting rid of it too fast, usually through the kidneys, and that can be sped up by certain drugs or even alcohol. And speaking of those drugs, some of the most common ones might actually surprise you. We're talking about medications tons of people take every single day for things like high blood pressure or acid reflux. Diuretics, water pills, and those super common proton pump inhibitors, PPIs, they can seriously drain your magnesium levels over time. It's like this hidden side effect that nobody really talks about. Okay, this is where we get to the really critical part of the story. What happens when those magnesium levels drop dangerously low, especially when it comes to your heart?
This quote from a medical journal says it all. Low magnesium, the technical term is hypomagnesemia, causes myocardial cell instability. That sounds complicated, but all it means is that the muscle cells in your heart become electrically unstable. And that instability can lead straight to some really dangerous, irregular heartbeats, or what doctors call ventricular arrhythmias.
So how does that actually work, like down at the cellular level? Well, it all starts with something called the sodium-potassium pump. Think of it as a tiny little gatekeeper in our heart cells that keeps the electrical balance just right. The thing is, this pump absolutely needs magnesium to work. So if you don't have enough, that pump starts to break down.
And once that pump starts failing, the next domino falls. Potassium, which is another super important electrolyte, is supposed to stay inside the heart cells, but now it starts leaking out. And losing that potassium from inside the cell, that's a huge problem.
And the end result of all this? Total electrical instability. The heart cells just can't keep their rhythm. It creates the perfect storm for life-threatening arrhythmias to pop up. It's a direct, predictable chain reaction. And it all starts with not enough magnesium.
In fact, there's one very specific, very dangerous arrhythmia that doctors immediately think of with low magnesium. It's called torsade de pointes. It's French for twisting of the points, which is pretty much what the chaotic rhythm looks like on an EKG. It's a super fast, unstable heartbeat that can spiral into cardiac arrest in a flash. It is a true medical emergency.
Okay, so knowing how serious this can be, how do you even spot it? Well, this is where it gets tricky again, because the signs can be really subtle, and getting a diagnosis isn't always as simple as you think.
The symptoms are all over the place, and they often get mistaken for something else entirely. You might have muscle problems, like tremors or cramps, but it could also be just feeling weak all over, losing your appetite, or even personality changes. Because these signs are so vague, it's really easy for doctors and you to just overlook it.
And that brings us back to that diagnostic challenge I mentioned. Remember that donut chart from earlier?
Since less than 2% of your body's magnesium is actually in your blood, you can get a standard blood test that comes back looking perfectly normal. Meanwhile, your cells and your bones could be seriously starving for it. That's why we call it a silent deficiency. The test everyone uses can miss it completely.
All right, so let's say it is identified, especially in a hospital. How did doctors fix it? How do they restore that critical balance?
Well, it really depends on how bad it is. If it's a mild case and you don't have symptoms, the fix is usually pretty simple: oral supplements and changing your diet to include more magnesium-rich foods. But if it's severe, and especially if a patient is having dangerous symptoms like those heart arrhythmias we just talked about, the response is immediate and aggressive. They go straight to an IV drip of magnesium.
And just to show you how seriously hospitals take this, take a look at this protocol from Vanderbilt University's Medical Center. This is what they actually do. Even if magnesium levels are just a little bit low, they're giving 4 grams through an IV. If it's severely low, they double that to 8 grams. They act fast and hard because they know the risks are just that high. Of course, for the rest of us, for just everyday health and preventing this in the first place, the best game plan is to get it from food. You just have to focus on whole foods. Think leafy greens like spinach, nuts like almonds and cashews, seeds, beans. All of these are fantastic sources, and you get all the other good stuff like fiber along with it.
And that really brings us to the final question, doesn't it? We've seen just how critical this one mineral is, and how a lack of it can mess with our body's most basic electrical wiring, sometimes with truly devastating results. We also know it's found in a ton of healthy, easy-to-find foods, so the only real question left is for you to ask yourself, is it on your plate?